There is no real theoretical maximum of CBD that you can take. CBD is so safe that you can't get a high from it. You really can't actually do that much harm when you take really high doses. The only sort of asterisk to that is taking it with certain medications, and particularly immunotherapy medications and cancer, and maybe with drug-thinning medications, we have to be cautious about that sort of thing. But maximum dosing from an efficacy perspective, there almost is zero, but zero risk as to going as high as we need, basically. When it comes to how effective it is, most people find improvements from a CBD perspective at about 50 to 100 milligrams of CBD per day. And that's generally a sort of a very common level that people stay on to help manage their anxiety. The second part of the question is THC. What's the maximum dose of THC prescribed in patients with anxiety? THC is a little different. THC is the one that has the bad rep. Like recreational users use high doses of THC to get high, essentially get stoned and enjoy the buzz from it. And at high doses, we know that there are side effects attached to that. So common side effects from THC can be dry mouth, dizziness, drowsiness. You can get the munchies. It can increase your appetite, and some people do feel a little bit have higher levels of anxiety when they take high levels of THC as well. So THC tends to have sort of a biphasic effect. So at low doses, THC can be good for anxiety, but at high doses, it may actually increase people's level of anxiety. So when it comes to dosing with THC, we've got to be a little bit more careful as to how we dose that. And so what we normally do is I get people to take it at really low doses initially, say about 2.5 milligrams at nighttime with their dinner. And so they've got a couple of hours just to get an idea of how the medication is working for them and whether they get any side effects. If they weren't getting any side effects after a couple of nights, then I would get them to take it twice a day, morning and evening, and then to increase by another 2.5 milligrams of THC every 2 or 3 days or so. You can increase it slower if you needed to, if you're a bit more concerned, or if you're elderly, then we may start at a lower dose, say 1 milligram, and increase by 1 milligram every 2 or 3 days. And second part, the other part of the question was, how do you monitor the patients? We like to catch up with patients about a month after they've started the oil, so they've had a chance to titrate the dosage and to get an understanding of how good it's working for them. I like to catch up with people once a month until we get good results, and then we can sort of review things on a longer duration after that. In terms of having to monitor other effects like biochemical effects, we know from the literature that THC and CBD generally is very well tolerated by patients, and we generally don't need to monitor their blood profile, like kidney function, liver function, blood counts, and that sort of thing, unless there's a specific reason for it. So it's best to talk to your doctor about that.